In this video, we are going to discuss about a ENT topic called dysphagia. Dysphagia refers to difficulty in swallowing. The word dysphagia is derived from Greek. It is divided into two parts. Phagia is to eat and dys means with difficulty. So swallowing with difficulty is dysphagia. The types, there are two types, oropharyngeal and esophageal. Oropharyngeal. When there is a difficulty in transferring the bolus from the oropharynx to the esophagus. So you can see the food, this is the oropharynx and this is the upper esophagus. Whenever there is a problem in transferring the food from the oropharynx to the esophagus is oropharyngeal. Esophageal. In esophageal, there is a problem in difficulty in transporting the bolus from the body of the esophagus into the stomach. So, there is a difficulty in transporting through the body of the esophagus. Okay. These are the two types, oropharyngeal and esophageal. Pre-esophageal causes. So, before the esophagus, that is the mouth, tongue, teeth, mastication, everything, what all the process which occur before the esophagus, then all those come under pre-esophageal causes. Starting with the disturbance in mastication. Guys, the mastication is nothing but the process of chewing the food. So, in conditions like trismus, fracture of mandible, tumors of jaw, disorders of temporomandibular joint, there is disturbance in mastication. So here they are talking about trismus. What is trismus? Trismus is nothing but locked jaw. You can see the jaw here. There will be spasms of the jaw muscles, because of which the mouth is going to remain tightly closed, which leads to disturbance in mastication. Then we see the fracture of the mandible, tumors of the jaw. You can see the tumor of the jaw. Disorders of temporomandibular joint. The disorders could be like arthritis, then joint disorders like osteoarthritis of the jawbone. All these come under the disturbance in mastication. Then the continuation, we see the disturbance in lubrication. So it is found in cases of xerostomia and S-Jordan syndrome. Xerostomia, it is a condition where there is a dry mouth. You can see the picture here, the tongue is totally cracked and dry. That is xerostomia, cotton mouth, dry mouth. Jordan's disease. In Jordan's disease, what's happening? There is a dryness of the eyes and also the dryness of the mouth, leading to tooth decay. It is an autoimmune system disorder. Okay, it is characterized by dry eyes and dry mouth. This comes under the disturbance in lubrication. Now we see the disturbance in motility of the tongue. The motility of the tongue is also really important for the deglutition to occur. To swallow, it should be good. The motility should be good. There will be the disturbance in motility in cases of paralysis of tongue. You can see the picture here, the paralysis of the tongue. Tumors of jaw in the next picture. Lingual abscess. Abscess is nothing but a cavity which is filled with pus. Painful ulcers of the tongue. All these conditions, the motility of the tongue is going to be affected. In paralysis of tongue, tumors of tongue, lingual abscess and painful ulcers. Defects in the palate could be a cleft palate. You can see the cleft palate here. Then it also interferes in swallowing process, leading to dysphagia. Lesions of the buccal cavity and floor of the mouth. So, the ulcerative lesions and Ludwig's angina. This is a term given here. Ludwig's angina. What is Ludwig's angina? Guys, it is a bacterial infection which is affecting the soft tissues in the compartments of the mouth. That could be the sublingual compartment, submental or submandibular. You can see a picture of a double tongue. There is a tongue and again a double tongue appearance in case of Ludwig's angina. This is a patient presenting double tongue in Ludwig's angina. It is a bacterial infection. Then we see stomatitis. Stomatitis, it is an inflammatory process which will affect the mucous membrane of the mouth and also the lips. They could be associated with ulcers, or it cannot be associated with ulcers, with or without ulcers. It's not necessary that the person having stomatitis should have ulcers. Not necessary. It's just an inflammatory condition of the mouth and also the lips. Okay, that is about stomatitis. Defects in the palate were cleft palate. And the lesions of buccal cavity and floor of mouth, we saw ulcerative lesions, ulcers, Ludwig's angina, then stomatitis. Okay. Then we see the pharyngeal phase causes. Now we come to the pharyngeal. These were the pre-esophageal. That is in the mouth. Then we saw in the mouth mastication, lubrication, tongue motility, palate, defects in palate, and also the lesions of buccal cavity and mouth. Then we come to the next part, that is pharynx. In pharynx, the pharyngeal phase causes obstructive lesions of pharynx. So there is some obstruction in the pharynx which is producing the difficulty in swallowing, that is producing dysphagia. These obstructive lesions could be in the form of tumors of tonsils, tumors of pharynx, tumors of soft palate, and the tumors of base of tongue and larynx. Okay, so whenever the tumors are present in these parts, now a picture here given the tumor of the tonsil, then obviously there will be a difficulty in passage of food leading to dysphagia. These tumors in these particular places is going to cause dysphagia. These come under the pharyngeal phase causes. Then under the pharyngeal phase causes, you have to write the inflammatory conditions. So guys, the inflammatory conditions could be the acute tonsillitis, acute epiglottis. So whenever there is an inflammation of epiglottis, it leads to epiglottis, acute epiglottis, and then tonsillitis, inflammation of tonsil. Peritonsillar abscess. So this peritonsillar abscess is also known as quinsy, where there is an accumulation of pus due to an infection. It is found behind the tonsil. This peritonsillar abscess is nothing but the accumulation of pus in the peritonsillar space. Okay, the peritonsillar space. Then what happens? The person will have the systemic symptoms like fever, and then localized throat pain will be there. All these conditions will be found leading to dysphagia. In these conditions, tonsillitis, epiglottitis, and peritonsillar abscess. Pharyngeal phase causes could be another thing, spasmodic conditions. The spasmodic conditions in tetanus and rabies. What happens in tetanus, guys? It is a bacterial infection which will cause the painful spasms of the muscle, and it can also lead to death. You can see the picture in the of the baby here. This kid is having the spasms. Then whenever there are spasms, the jaw muscles also undergo spasm, leading to dysphagia. And rabies, so a deadly virus which is spread to people from the dogs, from the saliva of the infected dog, then can also lead to spasms, lockjaw. You can see trismus here in rabies. Pharyngeal phase causes paralytic conditions, paralysis of the soft palate, paralysis of the larynx, and cerebrovascular accidents. So guys, under the paralytic conditions, you have to write the paralysis of soft palate and larynx. Continuation with that, you have to write cerebrovascular accidents. What are these cerebrovascular accidents? They are nothing but the stroke in the patients. The stroke is nothing but cerebrovascular accident. You can see the picture of the person here who have undergone stroke. They will experience the oral discomfort and pain. And the oral discomfort, it is especially because of the infection which is caused by candidiasis. This is nothing but the cerebrovascular accident. So these are the paralytic conditions: the paralysis of soft palate, paralysis of larynx, and cerebrovascular accidents. Okay. Then we come to the main actual esophageal causes. We saw the pre-esophageal, pharyngeal. Now we seeing the esophageal causes. Esophageal, there could be an obstruction to the lumen. So the lumen of the esophagus, you see the esophagus here, the lumen, the lining of the esophagus. Whenever there is an obstruction to the lumen of the esophagus, it is in conditions like stricture, tumor, and foreign body. Then we see the acute and chronic esophagitis or motility disorders. So the motility is also very important. So whenever the esophagus, the food passes, it passes in the form of peristalsis, that is closing and opening, wave like form. Okay, whenever this motility of the esophagus is affected, the hypomotility disorders Example, diffuse esophageal spasms. When is the motility of the esophagus lost? The esophagus loses its motility in case of spasms. You can see the spasm of the esophagus here, leading to the disturbed structure of the esophagus, leading to hypomotility disorder. Okay, in esophagus, what you have to write? You have to write there is an obstruction. The obstruction in the esophagus is caused by stricture, tumor, foreign body. This is the one point. In the next point, you have to write the acute and the chronic esophagitis. Inflammation of the esophagus, it could be acute or chronic, or there could be a motility disorder. Three things, guys. One is obstruction. Second thing, esophagitis, acute or chronic. Third, motility disorder. The motility is lost in cases of spasms, diffuse esophageal spasms. Okay. The lesions cause obstruction by pressing the esophageal from outside. So there are some other lesions which is pressing the esophagus from outside. What are these lesions? These lesions are hiatus hernia, cervical osteophytes, the thyroid lesions like tumors, enlargement of thyroid gland, Hashimoto thyroiditis. Okay. So let us see what is hiatus hernia and cervical osteophytes and so on. Guys, hiatus hernia, it is a condition where the part of the stomach is going to be pushed up through the diaphragm muscle. You can see in the picture here, this is the stomach, okay? This stomach and this is the esophagus. Whenever the part of the stomach is being pushed up through the diaphragm muscle into the esophagus, then it is known as hiatus hernia, okay? Then we see the cervical osteophytes. The cervical osteophytes, what happens? Those are the bone spurs which grow on the 7 vertebrae of the cervical spine. We have 7 vertebrae, right, on the cervical spine. In these C1 to C7, whenever the bone spurs are formed, they are nothing but the cervical osteophytes. Then we see the thyroid lesions like tumors, enlargement. Then Hashimoto thyroiditis is what they have given here. Hashimoto thyroiditis is nothing but a immune system disorder where the immune system will attack the thyroid. Initially, there will be inflammation which is causing the leak of the thyroid hormones. Whenever there is a leak of the thyroid hormones, there will be hyperthyroidism. Later on, it may turn out into hypothyroidism because of the excess leakage. But initially, what's happening in Hashimoto thyroiditis? The immune system disorder, it is going to attack the thyroid gland, causing the leakage of the thyroid hormones. As a result, there will be hyperthyroidism. Okay, this is about the lesions which are causing a pressure on the thyroid, which are causing a pressure on the esophagus. Okay, they are hiatus hernia, cervical osteophytes, thyroid lesions, and Hashimoto thyroiditis. Mediastinal lesion, tumor of mediastinum, and aneurysm. These are the next things. Then you see the mediastinal lesions here. The mediastinal lesion could be in the form of mediastinal tumor of the mediastinum, and then aneurysm. So aneurysm is nothing but the ballooning or the weakening of an artery. You can see the artery here. At places there is ballooning of the artery. This ballooning is nothing but the aneurysm. Okay.